The NMBA sets out standards for enrolled nurses. There are core practice standards that provide a framework for assessing EN practice or enrolled nurse practice. These standards are clinically focused and reflect the enrolled nurse's capability to provide direct and indirect care. They need to engage in reflective and clinical practice and demonstrate professional and collaborative practice. The provision of care encompasses all aspects of care, including interpretation of information, a range of sources to ensure appropriate plans of care, collaboration with others, and skilled care. Communication and documentation. Practice within these guidelines and standards of practice of care are supported by research and ongoing development. Professional and collaborative practice in accordance with the law, policies and procedures respects confidentiality and dignity, accepts accountability and responsibility for your own actions. In our nursing course, we utilise simulation with mannequins. As you can see, we have intravenous therapy, we have mannequins who can breathe, blink, groan, moan, and we can change their parameters on the screen according to what we want the students to learn. This has been reported to increase student confidence and it helps prepare students for the real clinical setting. The purpose of simulation is to replicate real-life scenarios so that the students can explore and develop critical thinking, problem-solving and practical skills in real-world scenarios within the context of teaching and learning. It can focus the experience and aims to improve patient safety and assist in achieving fitness to practice. The safety aspect means that we can give them experiences that they may not even experience out in the clinical arena, and enables them to practice it, reflect on what they have done, and then maybe come back and improve what they have done. Critical skills and clinical skills in a simulation environment offer repetition and opportunity to develop mastery to promote safe practice. Patient safety is paramount. Hence, having control of the clinical context reflecting real life permits practice and rehearsal of procedures. The environment is safe for the learner and the experience can be manipulated to reflect the needs of the student. The scenarios can assist students to recognise situations. Laerdal SimMan simulator displays physiological parameters on the screen that you can see, emulating a patient care monitor. The simulator provides a realistic approach to medication administration in a safe setting where the patient risks are eliminated. The benefits it offers are identifying appropriate drugs, dosages, routes, side effects and effectiveness. We are able to simulate distractions that may interfere with safe administration, and this enables structured lab experiences instead of trying to find opportunities in the healthcare setting. It promotes effective communication and teamwork, which is fundamental in nursing and patient care. It enables practice as a team member to determine appropriate interventions. It is immersive, providing a bridge between theory and practice. Students are able to visualise physiological responses and develop critical thinking and decision-making skills. We select the scenarios to meet the objectives and expose them to situations they may not encounter in clinical practicum, such that there is a benefit from learning from their own and others' mistakes and successes. It is an adjunct to complement teaching, not replace the clinical environment. It is important to pre-brief and debrief the students to enhance their learning and enable them to evaluate their experiences. Pre-briefing, they look at the scenario prior to coming to class, prior to doing the simulation. We discuss the scenario, and then they go in, they practice it with a couple of students watching them, and then we debrief how they went, what could they have done better, and what they did well, and then they can go back and practice it again to ensure that the experience is good for their practice and gaining knowledge.